Hello dear students, today we are going to discuss about the drugs acting on cardiovascular system. In that, today we will go through the pharmacology of Digitalis is a cardiotonic drug used in the heart failure. After completion of this course, you will be able to understand the concept of cardiotonics, remember the drugs used in the heart failure, and describe the pharmacological actions of Digitalis. Now, the drugs which are used as a cardiotonic, it is a category of cardiac glycosides, and cardiac glycosides having a cardiac inotropic property. They increases the myocardial contractility, means the contractility of the heart, and cardiac output. Some sources of cardiac glycosides are digoxin from the Digitalis lanata and other cardiac glycosides which are obtained from Digitalis purpurea, and aubain which is obtained from Strophanthus gratus. But nowadays digoxin is one of the cardiac glycoside which is used clinically. Digitoxin and aubains are not used clinically in today's scenario. Move on. Before starting of this, I request to all the students, please select this pause button and think about or recall the physiology of heart and conduction system of heart, what you have studied in the previous year. After that, by thinking, you may have written in your notebooks about the physiology of heart and conduction system of heart, like the electrocardiogram, different parts of the conduction system, which are the different pacemakers, chambers of the heart, and cardiac cycle, etc. etc. Now click on the play button and how to continue our discussion of pharmacology of Digitalis. The drugs acting on cardiovascular system, the Digitalis which acts onto the different organs like that heart, kidney, central nervous system, and blood vessels. So in the heart, Digitalis it has some direct effect on the contractility, which increases the contractility of heart through the vagomimetic action, reflex effects, and direct CNS effect, which increases the force of contraction. It shortens the systole, diastole is prolonged, and there is a more complete emptying of the heart, and cardiac output is increases and end diastolic volume reduced. It also onto the heart rate is decreases, which may result into the bradycardia, abolish the sympathetic overactivity, means it decreases the adrenergic activity, and Digitalis slows the heart as well as the depression of sinoatrial node as well as the atrioventricular node. Then pharmacological actions of Digitalis onto the electrophysiological property of heart, which includes it acts onto the action potential, it acts onto the effective refractory period, it also acts onto the atrioventricular conductions, and Digitalis it also acts onto the electrocardiogram or different segments of electrocardiogram. Now Digitalis it may have other effects onto the blood vessels. Onto the blood vessels, Digitalis which acts as a weak vasoconstrictor action, and it increases the peripheral vascular resistance. In congestive heart failure in the patients of CHF, more effect than the compensated, and by which it increases the sympathetic nervous system activity is there, and it decreases the peripheral vascular resistance. Onto the blood pressure, Digitalis increases the systolic blood pressure but decreases the diastolic blood pressure, and no significant effect onto the coronary circulation. After that, Digitalis may have other effects onto the other organs apart from the heart, that is kidney, central nervous system. So in the kidney, it increases the circulation and renal perfusion, which increases the urine output, that is diuresis, which increases the sodium and water excretion, and no effect onto the normal individual. Most of these are the effects are there in a heart failure patient, and no other effects onto the edematous patients like in edema. Onto the central nervous system, it has some little effects onto the therapeutic dose. On therapeutic dose may stimulates or activates the CTZ, that is a chemoreceptor trigger zone, which may result into the nausea and vomiting. Other effects onto the central nervous system may have a hyperapnea, central sympathetic stimulation, Some patient may experience about the mental confusion, disorientation and visual disturbances. So this is overall in brief about the pharmacology of digitalis. I hope you understood the pharmacology of digitalis in brief. Thank you and happy learning. Thanks.